And just 5 Indiana counties remain at the highest risk of coronavirus spread tonight. The state health department releasing this updated map this morning. It shows Marion and all surrounding counties now in orange. 8 counties are in yellow. Health officials confirmed more than 2,200 new virus cases today. 40 more people have died. About 1,900 Hoosiers are hospitalized. There are the numbers right now, and nearly 113,000 are fully vaccinated. Governor Eric Holcomb addressed the state about 90 minutes ago, saying that Hoosiers are stepping up.
This thing ebbs and flows. We've seen that over the course of 10 plus months. So again, we're on the right path, but we never want to get ahead of ourselves. We never want to overreach.
News 8's Dan Klein is following all of the latest developments in the state's pandemic response coming up at 5 o'clock. Well, millions of Americans already battling cancer, also at a higher risk of getting seriously ill from COVID-19. So is the vaccine right for those patients? Mandy Gaither has more.
If you're battling cancer, COVID-19 is yet another concern.
Patients that have cancer in and of themselves have a higher risk for contracting COVID. And if they were to get the infection, they have a higher chance of actually having severe complications or dying as a result of the infection.
That's why Dr. David Cohn, Chief Medical Officer at the James Cancer Hospital at Ohio State University, says cancer patients should strongly consider getting the coronavirus vaccine.
We know that it is safe to be vaccinated, that the risks from vaccination are relatively small, and the benefits in terms of protecting oneself from getting severe infection and complications from COVID is very high.
But since every patient is different, Dr. Cohn says to first talk to your doctor. Make sure there's no reason why a vaccination shouldn't be given. Then educate yourself on your vaccine eligibility, which varies state to state. Last month, the American Association for Cancer Research called for cancer patients to be a high priority when it comes to the COVID-19 vaccine.
Some patients might say, well, if I don't have as good an immune system, can I actually have a response to the vaccine? And the answer does seem to be yes.
For Health Minute, I'm Mandy Gaither.
The CDC says it's not known whether having a history of cancer increases your risk of COVID-19. Talking to your doctor can help determine your individual level of risk. Well, listen to this. Street side dining could be back in popular areas of Indianapolis. The Department of Public Works is developing a new effort with the mayor's office right now. The plan would essentially bring back last year's Dine Out program for the upcoming March Madness tournament. That would mean crews putting up barricades to allow more outdoor dining in places like Broad Ripple. There's a survey circulating right now around businesses to get opinions on the plan.
And we never stopped opting in because if there was one day that was going to be warm, we were going to get our patio back out. So any day that is available that's warm enough at least, we're going to do it. We invested a lot of money in patio furniture, heaters. We want to be able to utilize that equipment because we spent money on it.
Well, there you go. DPW says there's a good chance the Dine Out program could continue through summer or fall if its plan is approved. We'll see.